Welcome to my channel RX Sam 2020. Today we discuss a drug named SACUBITRIL plus valsartan. About: it is a fixed-dose combination medication for use in heart failure. It consists of the neprilysin inhibitor SACUBITRIL and the angiotensin receptor blocker valsartan. Also, it can be used in children 1 to less than 18 years old to treat heart failure. Heart failure is a chronic condition in which the heart cannot pump blood as effectively as it should. Novartis funded the Paragon-HF, prospective comparison of ARNI with ARB global outcomes in HF with preserved ejection fraction, trial designed to investigate the use of SACUBITRIL valsartan in treating heart failure with preserved ejection fraction, HFpEF patients with a left ventricular ejection fraction, LVEF of 45% or more. In 2019, it failed to show the significance of reducing hospitalization related to heart failure or death from cardiovascular causes. Medical use. SACUBITRIL valsartan can be used instead of an angiotensin-converting enzyme ACE inhibitor or an angiotensin receptor blocker in people with heart failure and a reduced left ventricular ejection fraction LVEF. Contra-indications: hypersensitivity or history of angioedema, biliary cirrhosis, or cholestasis. Concomitant use or use within 36 hours of ACE inhibitors or angiotensin to receptor blockers, ARBs. Concomitant use with aliskiren-containing products in patients with diabetes mellitus. Severe hepatic impairment, child PUG class C. Pregnancy, because it contains valsartan, a known risk for birth defects. Special precautions. Patient with risk factors for hypotension, for example, salt or volume depletion, myocardial infarction. Aortic mitral stenosis, risk factors for renal failure, for example, diabetes mellitus, hypoldosteronism. Hypoldosteronism, HA, is a condition marked by decreased synthesis or diminished release of aldosterone, ALD, from the zona glomerulosa of the adrenal glands, or resistance to its action on target tissues. Moderate to severe renal and moderate hepatic impairment, child PUG class B. Lactation. Drug interactions. Additive hypotensive effect with sildenafil and other phosphodiesterase type 5 PDE5 inhibitors. Increased risk of acute renal failure with nonsteroidal anti-inflammatory drugs NSAIDs. Increased serum concentration with rifampicin, cyclosporin and ritonavir. May reduce the serum concentration of metformin. SACUBITRIL may increase the serum concentration of organic anion transporting polypeptide 1B1 and organic anion transporting polypeptide 1B3 substrates, for example, atorvastatin. Increased concentration of statins. Valsartan may increase serum lithium concentration and toxicity. Increased risk of hyperkalemia with potassium-sparing diuretics, for example, triamterene, mineralocorticoid antagonists, for example, spironolactone, potassium supplements, or other potassium-containing salt substitutes, for example heparin. Potentially fatal, increased risk of angioedema with angiotensin-converting enzyme inhibitors or angiotensin receptor blockers. Increased risk of hypertension, hyperkalemia, and acute renal failure with aliskiren in patients with diabetes mellitus. Side effects. Dizziness. Hyperkalemia, high potassium levels in the blood, a known side effect of valsartan. Hypotension, low blood pressure, common in vasodilators and extracellular fluid volume reducers. A persistent dry cough and renal impairment, reduced kidney function. Angioedema, a rare but more serious reaction, can occur in some patients and involves swelling of the face and lips. Angioedema is more common in black patients. Sacubitril valsartan should not be taken within 36 hours of an angiotensin-converting enzyme inhibitor to reduce the risk of developing angioedema. Brand names that are mostly prescribed by doctors: Entresto, Vymada, Cidmus, Azmarda, Valsac, Neptaz. Warnings: when pregnancy is detected, discontinue sacubitril valsartan as soon as possible. Drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. What foods should be avoided while taking this medicine? Generally, avoid moderate to high dietary intake of potassium, especially salt substitutes, may increase the risk of hyperkalemia in some patients who are using angiotensin to receptor blockers, ARBs. ARBs can promote hyperkalemia through the inhibition of angiotensin to induced aldosterone secretion. Dosage: oral, may be taken with or without food. Chronic heart failure. Adult available preparations: sacubitril 24 mg and valsartan 26 mg. Sacubitril 49 mg and valsartan 51 mg. Sacubitril 97 mg and valsartan 103 mg. In patients with reduced ejection fraction, initially 49 mg and 51 mg 2 times a day. Dosage is individualized and may be increased after 2 to 4 weeks as tolerated to target a maintenance dose of 97 mg and 103 mg 2 times a day. Pediatric heart failure. Refer to the table for the recommended dose for pediatric patients aged 1 year and older. Take the recommended dose orally twice daily. Adjust pediatric patient doses every 2 weeks as tolerated by the patient. If the weight of pediatric patients is less than 40 kg*, then starting dosage is 1.6 mg per kg, the second dose is 2.3 mg per kg, and the final is 3.1 mg per kg. If the weight of pediatric patients is at least 40 kg or less than 50 kg, then starting dosage is 24 and 26 mg. The second dose is 49 and 51 mg, and the final is 72 and 78 mg. If the weight of pediatric patients is at least 50 kg, then starting dosage is 49 and 51 mg. The second dose is 72 and 78 mg, and the final is 97 and 103 mg. Use of oral suspension is recommended in these patients. Recommended mg per kg doses are of the combined amount of both sacubitril and valsartan. Hush doses of 72 and 78 mg can be achieved using 324 and 26 mg tablets. Special patient group. Patient with systolic blood pressure 100 to 110 mmHg, initially 24 mg and 26 mg tablet 2 times a day. Patient not currently or previously taking low doses of ACE inhibitors or ARB, 24 mg and 26 mg BID, double the dose as tolerated every 2 to 4 weeks. Maintenance 97 mg and 103 mg BID. Patient previously taking moderate to high doses of ACE inhibitors or ARB, 49 mg and 51 mg BID, double the dose as tolerated every 2 to 4 weeks. Maintenance 97 mg and 103 mg BID. Renal impairment. Moderate. Estimated glomerular filtration rate 30 to 60 ml per minute per 1.73 square meters, and severe eGFR less than 30 ml per minute per 1.73 square meters initially, 24 mg and 26 mg BID. Hepatic impairment, moderate, child PUG class B initially, 24 mg and 26 mg BID. Severe, child PUG class C contraindicated. Monitoring parameters. Monitor potassium levels at baseline and periodically thereafter, blood pressure, liver function test, and renal function, for example serum creatinine, blood urea nitrogen. Correct hyperkalemia, volume and sodium depletion prior to initiation of treatment. Mechanism of actions. This medicine contains a neprilysin inhibitor, sacubitril, and an angiotensin receptor blocker, valsartan. It inhibits neprilysin, neutral endopeptidase, NEP, via LBQ657, the active metabolite of the prodrug sacubitril, and blocks the angiotensin II type 181 receptor via valsartan. The cardiovascular and renal effects of this medicine in heart failure patients are attributed to the increased levels of peptides that are degraded by neprilysin, such as natriuretic peptides, by LBQ657, and the simultaneous inhibition of the effects of angiotensin II by valsartan. Valsartan inhibits the effects of angiotensin II by selectively blocking the AT1 receptor and also inhibits angiotensin II-dependent aldosterone release. Thank you for watching. Please like and subscribe to my channel and click the bell icon to get video updates.